America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. If you want to follow us on Facebook, you can do that at America's Healthcare Advocate. You can also do that on Twitter, the website, obviously, americashealthcareadvocate.com. And as you know, we are on over 200 radio stations coast to coast. Our latest is in Largo, Florida. Very happy to have those folks on board. But we are on 14 podcast platforms and YouTube, and the numbers just keep growing. It's amazing the number of people that are listening to these shows. So here are the platforms: Spotify, SoundCloud, RSS Podcasts, Overcast, Rumble, Apple Podcasts, Pocket Cast, Pandora, TuneIn, Stitcher, Spreaker, Amazon Music. I have no idea why we're on Amazon Music, and Google Podcasts, Odyssey, and then, of course, we're on YouTube. And the reason that I'm telling you all that is because we are getting some amazing numbers of people that are downloading these shows. About 11,000 a month. 11,000 people a month are actually going up and viewing or downloading these broadcasts on YouTube or on the podcast platform. So we greatly appreciate it. If you want to tell somebody about a show, this one today may be one of those shows. We have the folks from Blue Cross and Blue Shield of Kansas City in studio. We are doing our annual Medicare Advantage kickoff show. We're going to talk about all their plans today, what they're offering. There's some pretty cool things in here you're going to want to hear about. So again, if you want to tell somebody about this, go up to the podcast platform. If you don't catch it on the radio here on 980 or 98.1 or one of the other 14 affiliates around town, you can certainly go up on the podcast or YouTube, download the show, and listen to it up there. All right, so joining me in studio today from Blue Cross and Blue Shield of Kansas City, Baron Roberts. Welcome back for what is this, your fifth show, sixth show now?
Thanks.
You're a veteran now.
Yeah.
Yeah, you are. And in studio for the first time, although we've worked together for, 10 years, Angie Sutton has actually made it in the radio studio today. So welcome, Angie.
Thank you.
Glad to have you here. And Barbara Binns in studio with us today. Welcome, Barbara.
Thank you.
So we're going to be talking, as I said, about the Blue Cross and Blue Shield Medicare Advantage show. And we do this every year. This is our kickoff show to all of you out there who are chronologically challenged, just like me, if you have this kind of white hair, okay, then this show is for you, okay? And if you're one of those in the sandwich generation, I talked to a lady yesterday whose mother is 88 years old. She is a type 1 diabetic, and she needed some help, and I was able to help her, able to refer her. She is in charge of her mother's care, and she needs some help with the diabetes situation. I was able to connect her with some folks over at Medtronic, and they're going to be able to get her a pump and do some other things. My point in telling you that is, if you are part of that sandwich generation and you're managing care for your mother, father, grandmother, aunt, uncle, whatever it is, this show is important to you because you want to make sure they have the best coverage possible with the most benefits possible. And that's what you're going to hear about today as we talk about the Blue Cross and Blue Shield Medicare Advantage program and what it's going to look like for 2024. So let's just start off, Angie, with a little bit about Blue Cross. 85 years in Kansas City. I'm almost as old as Blue Cross and Blue Shield. I'm getting there. Baron's laughing. Okay. But let's talk a little bit about that. What does that mean? Local service, your impact in the community, all of that.
Well, Carrie, as you know, our headquarters is in downtown Kansas City. Our employees live, work, play in the communities where our members live, work, and play. And so you know that the person who is going to answer that phone when you call with a question about how do I use this benefit, help me understand my coverage, or explain to me what this claim means. We're right here in your community, and there's something to be said about the Midwest and the way people treat each other. And so if you call Blue Cross and Blue Shield of Kansas City, downtown Kansas City, our members are always treated with courtesy and respect. And conversely, brokers who also serve our members when they're helping a member, and they often do that on the behalf of the member, when they contact us, they get that same courtesy and respect. And we try to do first call resolution, which simply means we don't expect you to have to call us back 5 times. We are going to find that solution, that answer for you. And if not, we're going to follow up as soon as we possibly can to just ensure that that we're providing that superior level of service that our neighbors and our friends expect from Blue KC. And so, people often tell me, like, oh, I saw your crew out in the community. We do a lot of volunteer work too with various agencies across the community. We've got a big commitment with United Way coming up where we'll be contributing a lot of volunteer hours. So you'll see us out there, maybe even working alongside of us. And so that's another thing that certainly you can expect from our company, but really just local, honest, reliable. Those are words that come to mind when we talk to our members and the things that they say about our company.
You know, that's interesting. There's a reason they've won the J.D. Power Award 3 times in a row for best customer service of any health insurance carrier in this region. And what you just heard is the reason for that. And I will tell you, I've talked about it on this show. I mean, it was a month or so ago, I had to call about an issue that I had. It was answered on like the third or fourth ring, and the lady stayed on with me. It was about the dental plan and something about the billing or whatever it was. Mm-hmm. And the lady that handled it, I was on there probably 11 or 12 minutes, maybe more. She walked all the way through it, said, let me put you on hold. I got to go find this. I got to go. But she took care of it, and it got resolved. I got a credit for whatever that month was, and we changed the date, and it worked out. But that was the level of service that I got, and that was, and that's not unusual. Barb?
Yeah, I just wanted to add that one of the slogans our customer service reps have are give no homework. And so rather than say you need to call this person or call this person, anything they can do on your behalf, they try to do for you.
And that's that one call resolution. Mm-hmm. Yeah, it is important. And I think that, I'll just relay a little something here. So there is a carrier out there now that has moved their call center to Guatemala. Okay, I'm just saying. All right. It's not quite the same. You're probably not going to, if you call them and say, what hospitals are north of the river in the network, they're going to ask you what river. Okay. So you need to understand there's value to local customer service and a value to having people here in Kansas City to understand the difference between St. Luke's and HCA or KU Medical Center, whatever the case may be, in Liberty Hospital. That's the kind of stuff that, you have to be part of this community to get it. Baron, before we go to break, a little bit about broker involvement. Broker distribution is a huge part of what Blue KC does. I mean, my agency worked with Blue Cross and Blue Shield for 16 years, and we always had a great relationship. Talk a little bit about how important working with the brokers, local brokers, are in the, 20 counties now? We'll talk about it, but you're up to 20 counties now.
Yeah.
Okay, so talk a little bit
and
about
growing.
That. Yeah.
So the broker community is a very critical component of our distribution channel. In fact, the majority of our Medicare Advantage business does come through our broker community, and those relationships are invaluable to us. We just concluded our 3 major rollout sessions, and tomorrow we'll be hosting our Medicare Advantage Broker Showcase event, where they can come in and ask questions from our vendors that we have installed about how the benefits work behind the scenes, those extra benefits of the Medicare Advantage plans. I know we're going to dive into it later, but that's an opportunity for them to get inside, behind the walls, behind the scenes on how things work, and that's how important our brokers are to us from that perspective, giving them the insight that they need. In addition to that, a lot of the plan changes we made for 2024, which we'll talk about here in a little bit, was predicated based on the broker feedback we got. And we know that our broker partners are the closest to our members, and they do provide a lot of the feedback that's shared from our members to them.
And they're usually pretty frank about that.
Yeah, they're pretty direct. They're very direct.
I know, because I used to do it, so I know exactly. Yeah. That's not working. Change it. Yeah.
So, and we appreciate that level of insight, and we appreciate bringing them on site in the spring, right after AEP last year. We brought in over 50 of our broker partners on site downtown, right across the street from Union Station, and we asked them a series of questions. And it was not brief; it was a full day event. We had over 60 questions in follow up in addition to those questions, and it was a really great experience getting to hear all their feedback. A lot of that feedback we incorporated into the plans this year.
Yeah, and it's from that kind of thing that you learn. And that's the whole point, ladies and gentlemen. They're local. They listen to what the brokers and what people in the community say, and they adapt and they improvise to make those things become reality. So we're going to continue to talk about that. When we come back from the break, we're going to start talking about the plan designs. There are 5 of them, so we're going to spend the next 2 segments talking about these plan designs. This is the part you really want to listen to, because this is going to tell you what the benefits are and how their benefits are going to differ this year from what a lot of the other carriers are doing. There are things in here that they are doing that nobody else is doing, and we'll talk about that and how that can benefit you. So stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. We've got more. Don't go anywhere.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. Remember, this is posted on all 14 of those podcast platforms and YouTube if you want. Hey, maybe it's your grandmother, maybe it's your mom or your dad. Hey, Mom, you need to look at this and get off of that AARP or whatever you're on that's not working, because these folks have a really good plan at Blue Cross and Blue Shield of Kansas City, and that's why they're in studio. And if you want to learn more about it, the website is MedicareBlueKC.com, MedicareBlueKC.com. You want to call one of those nice folks that Angie talked about in the first segment, 833-957-7720, 833-957-7720. If you just want to talk to somebody, you can call them. It's not a high-pressure sales tactic. That's not the way they do things. And they'll explain the plans to you and tell you whether it makes sense for you or not. So there you have it. All right, let's get into the plan designs, and let's start with the first plan, which is the HMO plan, Angie. And now, that was only in a couple counties. Now it's in 9 counties.
That's right. So rolling out for 2024, we will have 5 plan options. And so it's critical that when you're looking for the right plan, that you work with someone who, as you said, can ask you the right questions about what your needs are to best fit you in a plan. So one of our plans is our HMO plan, which is that health maintenance organization, and it's called Blue KC Secure. And as you said, it's in 9 counties: Clinton, Ray, Clay, Platte, Wyandotte, Johnson, Jackson, Cass, and Lafayette. So the interesting thing is that an HMO is really good for someone who wants to have that extra little bit of care. So they perhaps they want to go to one of our SpiraCare facilities where they get that advanced primary care, and they're going to take and just really invest that extra time in their care and take them hand by hand. So this particular plan has a $0 premium, $0 deductible, $0 PCP copay. So you want to go to the doctor, it's a $0 copay. You also, if you were to have to get an x-ray or any sort of like diagnostic lab test, $0 copay on that as well. What I love about this one is that it comes with a $2,000 annual max for both preventive and comprehensive dental. So that's a pretty robust plan. And then what we're going to give you is $500 flexible benefits for eyewear and transportation. So perhaps this is the year that you want to get new frames and lenses. You've got $500 to spend on that.
That goes a long way at Costco, people. I'm just telling you, that's where I get mine.
It does. And if you need a ride to get to the eye doctor, you can spend up to this $500 on the full package.
That's 2 pair of glasses at Costco. I'm just saying.
And then you get that over-the-counter retail benefit. So we're going to give you $100 per quarter. So you'll get $400 for the whole year that you can buy vitamins, Band-Aids, all kinds of things that are, antacids is a big one. I mean, A lot of people will buy those. That's that a retail allowance that allows you to buy all of those good things that you might need. And what I really like about networks, sometimes networks make people nervous. This network in these 9 counties is the same network in the same 9 counties as our PPO plan.
Wow. So, first of all, let's just go back on this a second. That's a lot of zeros that she described. 0 premium, 0 copay, 0 x-rays. I mean, there are a lot of zeros in here. That's a good thing, right? The other thing is, if you add all this up, you've got a $2,000 annual max for preventative and comprehensive care. You've got $500 in flexible benefits. That's the hearing aid, the glasses, etc., and $100 per quarter to go buy your Prilosec with, all right? That's $2,600, right? I did the math right? Okay. So that's pretty significant if you ask me.
It is a robust plan. I think this is one that we built with a group in mind that, again, they like that extra care that they're going to get with an HMO. And this might be the right plan. I would just, again, suggest that you reach out to your trusted local broker or call Blue KC and let one of us ask you the right questions, walk you through what the plan design is and if it's going to fit your needs for the year 2024. And, what might fit your needs for 2023 might be different than 2024. You might have been diagnosed with something new, or, I got new glasses in 2023, so getting new glasses in 2024, those lenses and frames may not be important. And that's why we love those flexible benefits, because it allows you to use it on what you need for that particular year.
Yeah, and then talk about that dental benefit, because that's pretty significant.
Yes, so you have $2,000 for different levels of both preventive. So, it's oral health is so important. And I just encourage you to maintain your oral health throughout your entire life. And people will sometimes say, well, I have dentures, so I don't really need to go to the dentist. But it is very important, again, for your overall oral health that you continue to get that preventive dental care, that oral exam every year. And so you've got $2,000 for that work.
Yep. So it's pretty good. So we're going to flip the script a little bit here, and we're going to go back. Barb, I want you to talk a little bit. First of all, open enrollment begins on, actually, we can start talking about it on October 1st, which is why this show is running on that particular weekend. But the open enrollment actually begins for people when they want to call is on when?
10/1.
Okay.
So 10/1 is when when you will get a preview and you can talk about the new plans and what's changing. So that's the when you can preview plans. 10/15 is when enrollment happens. So that's the time when you want to reach out to your trusted broker. They can actually dive into the plan, see what's good for you, what should change for you, what works best for you. You can actually enroll during that time.
Yeah, and so it goes from 10/15 open enrollment where you can pick a plan, you can change if you're on that AARP thing or whatever else is out there, and you want to look at this and go, wow, Blue KC's got a great plan here. They've got things here that I don't have. Better network, better customer service. That's your opportunity, and it's over on December 7th. By the way, that's Pearl Harbor Day for those of you old enough to remember. But so that's a short window. So, it's important, I think, that they talk to the local broker, Barb, and not procrastinate or wait. And then this used to happen to us every year. People would wait. And then literally the phone lines would burn down with people. Everybody's nodding yes, because you've all been through this, right?
Exactly. So enrollment starts 10/15, it ends 12/7, and the effective date is 1/1. And so in that time, we know that our brokers are swamped. They are busy talking to people, helping them, stepping them through this process. So at Blue KC, we have implemented some new supports. 2 of those supports are Angie and me. We are the broker development and engagement managers, and we are here to support our brokers with their day-to-day questions and answer their questions right then and there. In addition to that, did you want to say something, Carrie?
Well, just, so if I contrast this with other plans, you don't have to go to the broker portal and enter it into the broker portal and then hope somebody gets back to you. It's a little different, right?
It is a little different. They can actually pick
up the phone and call you.
And we answer.
Yeah, gee whiz. How about that?
Our brokers have our cell number, quite honestly.
Yeah.
But again, like today, we're in a meeting, and so sometimes they need an answer, right away. We have our concierge line in addition, and it is truly a concierge email. So what our brokers do is they'll email a customer question about a claim or whatever that may be. They'll email this team, again, right here in Kansas City. If I had their picture, I'd hold it up right now. They'll email the team. The team will dig into this question, And then they'll reach out on the agent's behalf using the agent's name and get back to that member, talk them through what their next steps are, what the resolution is. Then last step is they'll email the broker and copy Angie or me with the resolution. So the broker is always kept in the loop, and they can be taking care of that while that broker is moving on to the next client.
That's really remarkable. And it obviously, as you can see, it is significantly different the way they do it than basically the rest of the carriers do it. If you want information, the website is MedicareBlueKC.com, MedicareBlueKC.com. The phone number, 833-957-7730, 833-957-7720. When we come back from the break, we're going to dive into the rest of these plans. The next one up is Simply Blue. This is the big one you want to listen to. Stay tuned. We'll be right back with more after the break. You're listening to America's Healthcare Advocate, broadcasting on the HI Radio Network, coast to coast across the USA. We'll be back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the fruited plain here on the HIA Radio Network. My producer, the always perfect Mr. Darren Wilhite. I'm your host, Kerry Hall. Behind the camera, Mr. Dave Thiessen, who videos all these shows and posts them on all 14 of those podcast platforms and YouTubes. That's how we get all this stuff up there. It's quite a production, but we do it so each and every one of you have a chance to go see those shows, listen to those shows. If you want to tell somebody about this, this is a great opportunity. If you're part of that sandwich generation, you really should look at this for your mom, your dad, your grandmother, grandfather, any other family member you're helping, because the Blue Cross plan is really different. And if you have a problem, and this is key, you heard Angie talk about this, you've heard Barron talk about it, the fact that their customer service people are right here in town and they're going to take care of you is, when you have that issue, when you've got a claims issue or a provider issue or you need information, it's critical. They're here, and they're here to help you. The phone number, 833-957-7720, 833-957-7720. The website, MedicareBlueKC.com, MedicareBlueKC.com. All right, let's start off with the big kahuna, okay? The one that is this is the plan that I think is going to knock everybody's socks off. Okay, it's called Simply Blue. Let's go, Barron.
Thanks, Kerry. It's simply that. I think it will do very well in the market this year. It's a very strong plan offering. This plan this year was designed based off of feedback from our broker feedback sessions in the spring. One of the pieces of feedback that we got back was that we needed a plan with more flexible benefits. How do we put more money into the pockets of our members and let them spend it how they need to spend it? So with that, we developed a new bundle. It's called a Blue Benefit Bundle. We at Blue like to call everything Blue.
That's a tongue twister.
It is the Blue Benefit Bundle.
See how many times I blow that up.
The BBB. So with that, we've got the active version of that Simply Blue plan. And just as a reminder for those out there who know what that plan is or those who don't, it's got a zero premium, zero PCP copay, $0 x-rays. It's zero deductible, very, very strong plan offering. But with that, on that active version of the plan, we are offering a $2,500 flex benefit.
Just stop right there. I want you to hear that. Okay, $2,500. And what do? They go buy something and send you the receipt and you reimburse them?
Oh, no.
It doesn't work that way.
No,
here.
that process
That's another plan. I'm confused.
Yeah. We believe in making sure the member has the access to the funds immediately on January 1st of enrollment. So with that, we want to make sure that they don't have the hurdles of having to overcome cash flow problems for direct member reimbursement and stuff like that. So with that $2,500 can be used for transportation. So if you need an Uber ride, hearing, vision, dental, all of those things, that $2,500 flexible benefit can be used for.
So do they get like a debit card for that, or how? They actually get a debit card with $2,500 on it.
Yes.
Are you hearing this?
Yeah.
You should have brought the card so we could show it to them.
Right.
I mean, that's really quite remarkable. I'm going to tell you something right now. I've looked at every other plan in the marketplace, every one of them. Okay. Nobody has this benefit. Period. Okay. So this Blue Bundle benefit, which I didn't bungle, okay, is $2,500 on a debit card, and it's yours. So now, let's say you are that caregiver and your mom needs this or she needs that. You don't have to take it out of your pocket. Take your $2,500 debit card and go get it. That's pretty amazing.
Yeah. So the intent and design behind that is to make sure we're providing affordable access to care and products, targeted towards health care. So with that, we're trying to create access from mitigating transportation issues, making sure people can get their eyewear that they need, dental benefits that they need, hearing benefits.
Yeah, what's interesting about this is, so now I got to go get a crown, okay, and it's $2,000, and mom's got Social Security, or my husband's got Social Security, or whatever the case may be, and a small pension, but coming up with $2,000 is a big deal for us, but I need that crown because I want to be able to keep using my teeth to eat, okay? You got $2,000 here. Walk in and get it done. I mean, to me, this is a big deal. In addition to the fact, I'm going to go through it again. We got a zero premium. We got a zero deductible. We got zero doctor office copay for your primary care, zero x-rays and zero labs. So if you're a diabetic, you need that A1C, boom, it's zero. You're not paying for that, okay? So, when you put all this together, this is pretty strong.
Very strong. And I want to call out one more thing real quick. We've got a $25 OSB, which is an optional supplemental benefit for dental. So they could tack on an additional $2,000 worth of dental. If they wanted to combine that with the $2,500, that's a combined total of $4,500 worth of dental work.
Holy cow.
Could get done. Yeah.
So for $25, I can buy another $2,000 worth of dental. So now I got a $2,500 debit card and I got a $2,000 benefit on top of that. So now you're talking $4,500 if I need to go get crowns, bridges, whatever the case may be. I'm watching you all nod your head. I mean, I think that's amazing. I've never seen this before. You guys have not done this before. In this robust a fashion that you're doing it this year. So somebody really listened to something because that's a big deal.
Yeah. Complete flexibility from that benefit for sure.
That's quite remarkable. Talk a little bit about the network and what the network looks like, because Angie mentioned it. So let's talk about where you can go. Okay.
Yep. So that Simply Blue plan is a PPO plan, and so you've got access to all of our PPO and all of our HMO network providers within our service area. So it's a very strong, very large network. And to this date, I've not heard any feedback on not having a specific provider.
Yeah. So we've got St. Luke's in there, we've got KU in there, we've got the HCA hospitals, we've got Advent in there. And the outlying areas, you've got Cameron Regional, you've got Liberty, you've got Golden Valley up in Clinton. Another thing, back to this customer service issue, try getting that question answered if you're calling Guatemala. You might find it a little difficult. I'm just saying.
So I do want to call something else out on that Simply Blue plan. It's got the same in and out of network benefits. So if you run into a hospital that's in a rural area that's maybe not in network, so long as they're accepting patients and you go there and seek care there, then you'll have coverage for those out-of-network hospitals as well.
What about the Blue Card?
National network. So we can tap into our national network on our PPO plans. So if you're traveling, you're outside of our service area, you can tap into our Blue Cross national network, which will allow you to have access to all the providers that are in our Blue Cross plans nationwide.
So if you load up that RV and you're heading down to Florida, get a little warmer weather in February when it's miserable here, okay? Guess what? You don't have to worry about am I in network or out of network, so it makes a big difference. Barb, you had something to add to this?
I was just going to make sure we brought up the national network because a lot of our members travel. So
yeah, and so that's and that's kind of a new development. What is it, about 4 years old that this has been going on now? Because in the Medicare Advantage plans, most of the other carriers, you're limited to the counties that they're offering that service in. Mm-hmm. So what Blue did nationally was the Blue Cross Medicare Advantage plans, as you just said, Barb, they've got a national network now. They can be in California, they can be in Florida, they can be in Arizona, wherever they are. Right, Angie?
Yes, and we would hope that no one would ever need MD Anderson or Mayo Clinic, but they are in network if you should happen to need one of those two facilities.
That's important. I didn't know that, and that's really important to understand. That kind of gives you an idea of the level and the quality of care that you need to understand what's going on here. So MD Anderson and Mayo, it's really funny. I've got a client the other day a radio listener who called me and wanted to know about Mayo, and this was a regular health insurance plan, and yes, they were covered. But the point is, it's covered under these Medicare Advantage plans, and I think that's probably unique to Blue KC. I'm not sure, but I think it probably is. It's certainly something you want to keep in mind, along with the fact that you've got a national network if you happen to travel. I just can't get over this Blue Bundle benefits. I did this 3 times now without screwing it up.
Yeah.
Okay. So, I mean, to me, this is remarkable.
Yeah. And so while we're on the topic of networks, I also want to throw in there a little bit closer to home. Barnes Jewish Hospital in St. Louis is also one. So I got a question on that the other day. So anybody out there wondering, they are also in network. And then as far as networks go from the dental perspective, we are changing our dental network provider, and we are developing our Blue Medicare Advantage dental network, our own dental network.
Wow.
For January 1.
Okay.
So we're really excited about that. That was another piece of feedback we got from our broker community.
It's going to expand the network.
It is going to create a much larger network with more access to the physicians and dentists that members are looking for.
That's really quite remarkable. And the brokers are going to know all of this, Barb, because you've rolled all this out in your broker meeting. So, once again, they go to their local broker, they can get this kind of information from the local broker, right?
So, and if we had the possibility to do like fireworks in the background or loud clapping, this dental network, we would add it.
Yeah.
This is big news, and the brokers have asked, and we've heard.
Yeah, because this is a big deal. You've got, I'm going to wrap this up as we're going to come out of this segment. Remember what he just talked about, okay? You've got a total of $4,500 here. If you choose to upgrade to the $2,000 additional dental plan, you've got $2,500 if you don't do anything. And you're not sending in receipts. There's one of the plans out there that you're sending in receipts to. You're not doing that here. You got a debit card. Go do what you need to do. That's what you just heard him say, and that was the feedback. So we'll be right back after the break. If you want information, the website is MedicareBlueKC.com. It's all up there, MedicareBlueKC.com. You want to talk to somebody, 833-957-7720, 833-957-7720. You want a broker name, somebody to go to, call them. They'll get you somebody local you can talk to. We'll be right back after the break and wrap it up. You're listening to America's Healthcare Advocate, broadcasting on the HI Radio Network, coast to coast across the USA. Stay tuned. We've got more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. All of these shows are posted on 14 podcast platforms. I read them off to you in the beginning of the show, and YouTube. So you want to tell somebody about this. You've got a family member, maybe a friend, somebody in your church or in your group. Go to the website. If you don't hear it on the radio, you can certainly go do that. And all the information is up. There's a lot of information here today. This is like drinking out of a fire hose, listening to everything we've got going on here. But this stuff is, it's important to understand. Where else are you going to get a total of $4,500 of benefits that you get to choose and do what you want to do? Nowhere. Okay, it's only at Blue KC. The phone number is 833-957-7720, 833-957-7720. MedicareBlueKC.com is the website, MedicareBlueKC.com. All right, let's go right to Angie, the Essential Plan real quick, and then I want to talk about the Veterans Plan for all of you veterans out there. Let's start with the Essential.
Hey, Carrie, you mentioned the website. And so folks, write that down. And on October 1st, you're going to get all of these new plans, all of the details on those new plans. So mark your calendar for October 1st, and you'll be able to see those. Our ever popular Blue KC Essential PPO plan, we're keeping that as consistent as we can year over year. Our members say, often if, can you just not change the name? Can you keep the majority of the benefits pretty consistent so I don't have to relearn? And we are doing that. But I would say, it'll continue with that $0 premium. It's going to have that $1,000 annual max for preventive and comprehensive dental. Still have that $500 flex for both the eyewear and the transportation. But one change that we heard members and they said, can I just get all of my OTC up front instead of $100 per quarter? So what they'll get is $250 on their Blue Benefit Bucks card for OTC on January 1.
OTC is over the counter,
Over the
people.
counter.
So those of you that don't, okay.
Those retail products. So if they want to buy, we kind of joke and we say, if they want to, to buy $250 worth of Band-Aids on January 1, they can.
Prilosec, I'm telling you, spend it
There
on
you go.
Prilosec. They have it at Costco. Okay.
Yes, so that's going to be our essential plan. And so if you currently are on that essential plan, which we have a lot of folks who are, and you think that Simply Blue plan for 2024 sounds pretty darn good, I would encourage you to reach out to your broker. Get on their list so they can start talking with you 10-1
Yep.
about what is going to be a better fit for
And if you don't have a broker, call 833-957-7720. All right, so that gets us there. Now I want to talk, this one's near and dear to me because I'm a Vietnam vet. And, look, the VA, they're nice people, okay? But if you're a vet or if you're a family member with a vet, that getting in there and getting something done can often take a long time. I'm talking sometimes 2 or 3 months to get a surgical procedure, see a specialist, whatever the case may be. It's not the most efficient system in the world, okay? Well, guess what? There's a plan now called the Valor Plan for veterans. And all of you veterans and family members of veterans, the big issue was always in the past, well, I'm going to lose my VA prescription drug benefits. You can keep your prescription drug benefits with the Valor Plan, and you can access what?
Well, first, thank you for your service, Carrie. Second, the Blue KC Valor PPO plan has access to Spira Care centers all across the metro.
And what's the wait time at Spira Care?
They can often get you in the same day, if not the next day. We've had, folks who say, I expected to go in and sit down in the very comfortable chairs and in the very beautiful waiting room, but they don't even sit down. They check in at the front desk and they're taking them right on back to get that, to see those care providers.
All right, so let's talk about what's in Spira Care. This is also a zero premium, zero deductible, and zero doctor office copay, and zero x-rays and lab. That's all 0, 0, 0, 0, okay? But let's talk about the Spira Care piece, because you're a vet and you're used to going to the VA. This is like going to the VA on a gold standard, okay? It's a far better program in terms of how access and how quickly you get in. Let's talk about it.
So the great thing about Spira Care centers is they have what we call advanced primary care. So you're, really like that white glove service the moment that you walk in. You have a care guide. So say, maybe you need to be referred to a specialist. Your care guide that you're automatically assigned as a patient at Spira Care is going to help you. You're not going to be in the dark like, gosh, were they supposed to call me or was I supposed to call them? You've got a care guide helping you through every step of the way. And they've got all kinds of services. Sometimes people think it's an urgent care. I could just walk in and get care. That's not necessarily true. It's more than an urgent care. So, we had a staff member who had a child that sprained their ankle and they were able to get in almost right away, x-rays right on site. Just that white glove service. And for our Medicare members, we just hear that they really appreciate it. It's the waiting rooms are comfortable.
They're beautiful facilities. I've been in them multiple times, and they're beautiful facilities. And they don't look like a medical facility. Let's just put it that way.
They don't. And we're up to 9 of those centers now. So they're all across the metro. And again, if you haven't looked into what Spira Care centers are, I would really highly encourage you to do that. SpiraCare.com.
So, and they are available, by the way, on all of the Medicare Advantage plans. So every one of these plans has access to Spira Care. So if you want that kind of care, if you want that care guide, again, let's go back to the vet thing. Okay, you're a veteran and you've been to VA and you need a surgery. How long are you going to wait? Okay, what is that like? Okay, here, you don't have to do that. You've got a care guide. Maybe that's your dad. Maybe that's your grandfather, and you're helping them, okay? Well, you need to look at this, all right? Because now you've got a partner that's going to help you manage the health of your dad, your grandfather, your uncle, whatever the case may be. Maybe they're a type 1 diabetic. Okay, and they need constant care, A1Cs and all the rest of it. These folks do all of that. By the way, there's also behavioral health. A lot of vets have issues with this, okay? PTSD. I've got one of the guys at my church that's had a very, very difficult time. Came back from Afghanistan. He's a mess, okay? He needs care. That kind of care is available at Spira Care. They have behavioral health people right there. You don't have to go see somebody. They're right there. Am I right?
That is correct. And, let's just say, again, you mentioned earlier, you're traveling. Maybe you're going south. This plan, the Valor plan, has the same in and out of network costs as well.
Okay.
So you can access that National Blue Card. $1,000 flex benefit for dental, hearing aids, eyewear, transportation combined. So you'll be able to use that, whatever makes the most sense for you for that year. $500 OTC loaded on your Blue Benefit Bucks card, January 1. And again, this plan does not have prescription drugs, so you're not going to endanger your prescription drug coverage.
There it is. You've heard it all. Okay, we've gone through all 5 of the plans. You know what's available now, how to get them. The website, once again, is BlueKCMedicare.com. Excuse me, MedicareBlueKC.com, MedicareBlueKC.com, 833-957-7720. Look, I'm just telling you, take the time to look at what they're offering. I don't care what plan you're on. Maybe you think it's great. Maybe it is, okay? But at least take the time to compare. Go to your local broker. You don't have one, call them. They'll be happy to walk you through what they've got and compare it to what you've got. You may find it's a much better deal. That's why we do these shows. The idea of this is to educate you, the public, about what's available. I think they've got a great program. My wife and I have been on a Blue Cross and Blue Shield Medicare plan for 15 years, okay? And we think it's a great plan. So I'm just telling you, I think it'd be the best thing you could possibly do. And I strongly suggest you take a look at it. Once again, the website is MedicareBlueKC.com. The phone number 833-957-7720. And now I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words were never spoken. Thank you for listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Goodbye, America.